Hi everyone, it's Adrian Leah. This video is about the holistic uses of Horsetail Equisetum arvense. I'm reading the script that I wrote for this video off of my laptop. I'll insert my references in the description bar and post my script in the blog section of my website. Horsetail is classified as an archoretic, removing water without removing electrolytes. This effect is mistaken for diuretic properties, though it's said that horsetail has diuretic capabilities as well. It's a general stimulator of metabolism and gently increases urinary flow to release infectious fungi, viruses, parasites, and bacteria such as Escherichia coli, with its diuretic, astringent, and antimicrobial properties. And this is releasing it out of the bladder. Because of these effects, drinking water is important when taking it, as it can cause dehydration. Using horsetail in powder form can also be used for age-related memory impairment, because electrolyte imbalance is associated with this type of memory loss. It can also help treat edema. Horsetail has 40% silica content. Its silicates are immensely water-soluble and occur in colloidal dispersions, so it makes the silicates constantly dispersed and it's unable to remain still, or they're unable to remain still. It's traditionally used for treating hair, skin, and nails of the integumentary system. Silica is made up of silicon and oxygen, which are chemicals used in the synthesis of collagen for building its strength and elasticity. Horsetail can help with wound healing. It can help with nosebleeds and treat burns by applying it directly to the affected area of skin. It can be useful if one has silica deficiency. A person that has silica deficiency may be prone to various ailments like skin damage, wrinkling, hair thinning, soft and brittle nails, as well as insomnia, irritability, muscle cramps, and poor bone development. Silica can help build bone and strengthen the immune system. Silica is an important component of traditional uses of horsetail. However, modern herbalists question the bioavailability of silica in horsetail and how it affects metabolism, since there aren't many studies done to support previous observations. Additional studies are needed to identify functions of silica in the body. Horsetail is also high in calcium and minerals. Zinc, copper, and iron are some examples, making it beneficial for forming red blood cells, the regeneration of connective tissues, nourishing joints and bones, and healing broken bones. Other types of tissue repair are bleeding ulcers, hemorrhoids, and heavy bleeding immenses. It can help with lung tissue health and repair, with kidney inflammation or kidney stones and a urinary tract infection. It helps reduce eyelid swelling by using tea bags, and it can help with bleeding gums if you gargle it. It may be used as preventative treatment for osteoporosis by improving bone building capability of osteoblasts, and these are cells that are part of the bone forming process, and by preventing infections linked to bone fractures or osteoporosis. It contains hyaluronic acid, KYNA, giving it antioxidants, anti-inflammatory, and pain-relieving properties. These properties can help treat inflammatory and degenerative joint diseases such as rheumatoid arthritis, RA, because with RA, those with RA tend to be low with KYNA. KYNA also has immunomodulatory effect on B and T lymphocytes, B being the bone marrow cells and T being thymus cell responses. These cells are essential to the immune system and for autoimmune arthritis, like rheumatoid arthritis. Horsetail alleviates symptoms of RA, fatigue, joint stiffness, swelling, and pain are some examples. Horsetail can halt production of cancer cells with its saponins, antioxidants, and anti-cancer, anti-tumor properties. It's recommended to use horsetail in small quantities and not to take it for more than 6 weeks because it can cause damage to the digestive tract and it isn't recommended for pregnancy. It's important to use young spring horsetail because it can absorb contaminants of the soil and water as it matures. Effects are contradicted for those with kidney stones if one takes ACE inhibitor for blood pressure and who have congestive heart failure. Thank you guys so much for watching. I hope this was helpful. I'll see you in another video.